So we're going to use a total of 2 syringes of Voluma. So 1 syringe on each side. I'm going to start here, and you might feel or hear a little bit of a crunching noise, and that's completely normal. So 1, 2, 3, stick. So we're just going to inject small boluses as we go along this arch, laying the product down along the bone. With any of these injectables, it typically takes about 2 weeks for the product to settle in, so to speak, and for you to get to the final result. It's very normal for there to be a little bit of bleeding and therefore a little bit of bruising, sometimes some swelling the next couple of days. Typically all these symptoms resolve after about five or so days. So I like to go to where I form this cross, and then I come back around and fill in the hollowing underneath here with a fanning effect with the remaining product. Okay, pretty quick, really easy. I'm going to let that settle in, and then I'm going to come back afterwards and massage it into the tissues on top of the bone. If you see any little bleeders, just hold pressure, because that will not only help the bleeding to stop, but it can prevent bruising the next day. I usually tell these patients to avoid taking any type of blood thinning products like aspirin or ibuprofen for at least 24 to 48 hours previous to the injection, and then avoiding it for a couple of days afterwards too, just to minimize bruising. All right, so moving over to the other side. So same procedure here. I like to start very close. I'm going to have you tilt your head away from me just slightly to the ear here. 1, 2, 3, stick. Because that gives a nice little thumb tacking effect, which will also help to improve the jowling and help with her jawline too. This product can do a lot for you. I also like to start with the Voluma first, because when we move down to the nasolabial folds and the marionette lines, after Voluma has been injected, you typically require less product for those areas once you have injected the Voluma. That's an example of how these products, when they're used together, they can work very well together and complement each other. Okay, so same thing. I went right along this line. I'm going to come down below here with my remaining medication and do that same fanning technique to fill in any hollowed areas that remain. So very quick. These patients are in and out and back to their normal routine. The only restrictions I give them is to avoid heavy exercise for the first 24 hours after any type of injectable. That way that assures that the product stays right where we place it. I'm just going to hold pressure here for a little bit. So next we're going to be moving on to the Juvederm. This is where we're going to be targeting the nasolabial folds, these oral commissures here, and the marionette lines that we all face eventually at some point in our lives. Again, I'm going to be using a total of 2 syringes of the Juvederm, 1 syringe to address each side.